This idea that the narcissistic person has a really robust self-esteem and thinks highly of himself and has a big ego, so to speak, it really doesn't actually capture narcissistic pathology very well. People who have good self-esteem, who may feel proud about their accomplishments and their achievements, those people tend to be pretty healthy. It's when it's so exaggerated and makes up for a deficit in the self. The narcissistic patient has very fragile self-esteem.
Hello, everyone. Welcome to the Narcissism Decoder. I'm your host, Dr. Anthony Mazzella. Today, I'm joined by Dr. Mark Ruffalo, a psychotherapist in private practice and assistant professor of psychiatry at the University of Central Florida College of Medicine. He also serves as the director of psychotherapy. That's a training program in the psychiatry residency program. And he's also on faculty at the New Jersey Institute for Training in Psychoanalysis. So yes, this sounds like a very busy fellow. So we're really lucky to have him here with us. And I was looking forward to my conversation with him because I had so many questions about an article that he wrote, Narcissism, the Need for Conceptual and Diagnostic Clarity. I'll link the full article in the show notes for those of you who want to read it in full. The article stood out to me because it pushes back against something we're all seeing more and more of. The way the term narcissism gets used so broadly that it starts to lose its meaning. What I found especially compelling is how he frames narcissism in a way that calls for greater clinical precision, trying to clarify what we're actually referring to when we use the term, rather than allowing it to become a catch-all explanation of why somebody or why you are behaving the way that you're behaving. In this clip of our conversation, we start right there at the tension between how narcissism is talked about on social media and how it's actually understood clinically. We explore what's getting lost when the term is used too loosely and why that loss of precision matters. From there, we move into something more immediate and lived. I asked Mark to take us into his consulting room to walk us through a prototypical clinical moment where narcissistic personality organization is present and to help us understand how that reveals itself in real time. Look, we get into a lot more, such as the difficulty of differential diagnosis. We touched on that a bit as well. And I wanted to talk to him about borderline dynamics. Unfortunately, we got away from that, but we did talk a little bit about the need for more precise diagnosis in terms of treatment. Anyway, this clip really sets the foundation, both conceptually and clinically, for thinking more clearly about what narcissism is, and just as importantly, what it isn't. I'm really excited to share this discussion with you. So let's get right into my conversation with Dr. Mark Ruffalo. Hello, Mark. Welcome to the Narcissism Decoder. I'm really excited to have you here with us today. For the audience, I was just saying offline to Mark that we're really lucky to have him because he's a busy guy. I told him I took a look at his curriculum vitae and he has a lot going on. But welcome, Mark. Thank you again.
Yeah, thanks so much for having me, Dr. Mazzella. I've been looking forward to doing this and talking with you a little bit about narcissism.
Yeah, so let's get right into it because I've been reading up. You've obviously published quite a bit, but there's one article in particular which I'll reference in the show notes for anybody who wants to see the full article. But I think it sets the stage because in that article, the title is Narcissism, the Need for a Conceptual and Diagnostic Clarity. So what you're really pushing for is clarity around the diagnosis of narcissism, especially in contrast to how loosely the term is used culturally. So you write that there is this growing cultural fixation on narcissism. I'm quoting from your article. Just bear with me for 1 second, okay? So where the term is routinely used to describe a wide array of issues, including normative, and I put emphasis on that, personality traits or symptoms of other clinical syndromes. And I put emphasis on that too, because those are two things I really want to pick up on and get your idea of what you mean here. Like, what's the misunderstanding? Maybe that's a good place for us to start. Like, what's the misunderstanding about narcissism? And what kind of clarity did you have in mind that would be necessary?
It's a great place to start. If you hop on social media, And I try to stay off of social media for the most part these days. I'm active on LinkedIn, but that's about it. But it seems that the talk of narcissism is everywhere. And to a lot of online commentators, including some mental health professionals, narcissistic personality is ubiquitous. It's all over the place. And when you look at the DSM definition and category, the prevalence of narcissistic personality disorder is about 1 or 2% of the general population. That's a pretty rare condition.
Yes.
It's fine to talk about narcissism as a personality trait, which is how a lot of psychologists are conceptualizing narcissism these days. But one thing that I've become very interested in particular with my friend and colleague at Tufts University in Boston, Nasir Ghami, is the question of diagnostic validity, whether the diagnoses that we use and are listed in the DSM really point to valid syndromes, valid diseases or conditions. You know, a lot of these folks on the internet, on social media and the like, don't realize that narcissistic personality disorder was set to be eliminated from DSM-5. It was actually saved by a group of clinicians who saw the value in the diagnosis. But narcissistic personality has rather poor discriminant validity. It's hard to delimit it from other conditions. And most people in research world these days conceptualize it more as a trait, as a dimensional trait, and not as a disease per se or condition per se. For instance, when you look at validity of personality disorders, 2 of them stand out as robustly validated. That's antisocial personality disorder and borderline personality disorder. They have good convergence across the classic diagnostic validators that Robinson Guzet talked about in the 1970s. Narcissistic personality disorder, it struggles with empirical validity. And so I don't think a lot of these folks who talk about narcissistic pathology are really aware of the debates around whether the disorder really exists as a discrete syndrome or is better captured as a trait, which in excess we call pathological.
Can I just jump in there quickly? Because I'm curious with that thing that you just mentioned. What's your sense then? I mean, do you have any hunch? Like, what do you think is happening? Like, in other words, why are people so free to use that label? Are they maybe reacting to something? Like, why that label, in other words?
It's a really good question. Well, I think once a term gets into the cultural lexicon, it sort of takes on a life of its own. And so I think a lot of people use it without really realizing what it points to or purports to point to. You know, when I listen to some of the other podcasts and even, you know, mental health professionals talk about narcissism, pathological narcissism, it often seems to me that they're describing features of other clinical syndromes, either antisocial personality or borderline personality, or normal narcissism or healthy narcissism, which is the presence of a good self-esteem in the face of adversity. Or, and this is where some of my work with Dr. Ghami comes in, it's used to describe people who have hyperthymic temperaments. Hyperthymia is on the bipolar spectrum. People with a hyperthymic temperament may have lots of energy. They tend to talk a lot. They're very enthusiastic. They can be impulsive. Sometimes they get themselves into some trouble because of their impulsivity. They don't need to sleep very much. And this can very easily be mistaken as pathological narcissism.
That's, I can imagine right there, Mark, that could be a differential diagnosis because people with narcissism, at least from my experience, it's not that they don't want to sleep. You see, what you're describing are people maybe who are in this state, who have an abundance of energy.
Yes.
They may not at that moment be too interested in sleeping because they have too much to accomplish. I mean, is that right? Or
yeah, exactly. And so we don't talk about mood temperaments because they're not listed in the DSM, but the mood disorder people, you know, have found that about 20% of the general population has an affective temperament. That's hyperthymia, cyclothymia, dysthymia. These go all the way back to Emil Kraepelin in the 1800s. So, you know, what I was trying to do in the article with Chiara Stahl in the Netherlands was really to say, well, if we're going to use terms, we ought to be precise with them.
yes,
To be careful, and we ought to be judicious. I absolutely believe that there are individuals in the world for whom a diagnosis of pathological narcissism applies. There's no doubt why. But we ought to be judicious and careful and apply the term in a way that is appropriate. Otherwise, our diagnostic terms get so diluted and they're used so loosely, it really becomes hard to know what people even mean when they say narcissism or narcissistic these days. Yeah, so I think there's different forces going on. I also find that sometimes the diagnosis of narcissism is imputed to others.
Let's take a quick break.
Are you tired of feeling like you're walking on eggshells all the time? Do you feel drained, confused, or like nothing you do is ever good enough? Are you stuck in a cycle of elation, then criticism and confusion? If any of this sounds familiar, you're not alone. And that's exactly why I created Office Hours with Dr. Anthony Mazzella. That's me. Office Hours is a low-cost, small group space where you could bring your questions about narcissistic traits and dynamics and the places where you feel stuck. You'll be met with honest, grounded feedback. I'll hold the group with structure, but there's also space for a real conversation. This is a space designed for anyone looking for clarity, insight, and support. If that sounds like you, just click the link in the show notes to join us. Okay, I hope to see you there. Yes, that's what I want. I did. I wanted to talk to you about that. Yeah,
They
please.
struggle with some of these defenses like splitting.
Yeah, I noticed that was something in the article as well, that I'm thinking about something that you touched on, that one hypothesis that you came up with is that it's attributed to others, right? Because the people who are accusing their partner, parent, whomever of being narcissistic may actually be struggling with their own, what you call primitive defenses. I tend to use this word as well, but I always make it very clear. We're using primitive not in a pejorative way, right? But that we're saying these are very early defenses. And one of them, as you just mentioned, Mark, right, is what we call splitting. But maybe you could speak to that. Like they're attributing narcissism to other people, overly attributing it, right? Or incorrectly, but because of their own splitting. Can you say a little bit more about that?
Yeah. So, just to start, splitting refers to this tendency to see things as either being all good or all bad in a very black and white sort of binary way. We all engage in splitting. Go to a Mets and Yankees game and you'll see splitting all over the place, right? Or around the weeks leading up to a U.S. presidential election, red is good, blue is bad, or vice versa. We all engage in this to some degree. People who have problems with splitting use it to excess. They use it to the exclusion of healthier defenses like humor, for instance, right? So if one has a tendency to engage in this sort of dichotomous thinking that we call splitting, any frustrating other who doesn't seem to pay enough attention to me or doesn't seem to care enough about me may be interpreted or perceived as being narcissistic, right? So I find that, sometimes, although this is certainly not always the case, when narcissism is imputed to others, it may say something about the person who's making the allegation.
Yes.
And so if we think of the prevalence of NPD as being 1% to 2% in the general population, let's say you've had 5 serious romantic relationships in your life, your chance of having had a pathologically narcissistic partner is maybe 5 or 10%. That's a pretty, low chance that you've coupled with someone with pathological narcissism. Now, that doesn't mean that all of these people are, engaging in splitting. I certainly don't mean to imply that.
Sure.
Seeing with someone who's pathologically narcissistic can be one hell of a time. It can really wreak havoc on interpersonal relationships. There's no doubt about that. But
Well, to that point, that's one way that I think about it. If someone, I remember early on in my podcasting profession, right, a listener wrote in and she was talking about wanting to, have a better relationship with her husband, but he is a covert narcissist. And I wondered about that. And she said, look, if he has the diagnosis, why should I not call him a covert narcissist? Right. But to your point, Mark, you have to think about what's the ultimate goal. Are you trying to diagnose somebody or are you trying to have a closer relationship? Because, being called a narcissist obviously arouses some feelings. So that's one thing. I know you didn't get to this in your article, but I imagine that also it's a way to keep a distance. So if you're labeling somebody in that way, it creates an emotional distance because it's like they have something wrong with them. In other words, I don't, they do, this is their problem. Yes. And that creates a bit of a separation and not such a level of connectedness in the relationship.
Absolutely. You're right. I didn't touch on that on the article, on the sort of interpersonal consequences of this, but I think that's very true. I think these are clinical terms. They have precise meanings. I think it's important that we keep that in mind, that these terms are not to be used lightly and to be thrown around in a very casual way.
So splitting is a defense, right? So if we think about that just for a moment, if we're talking about the label narcissism as a defensive function, then we'd have to think about, and I know you mentioned this a moment ago, I'm just highlighting it, that it's designed to protect yourself from something, right? That's typically why we, use our defenses to protect ourselves. And also you mentioned, I just wanted to pick up on one other thing, is it keeps things simple. Like your example, I love that example, by the way, of going to a game, right? I usually say a football game, okay. But it keeps things simple. And simple sometimes is more pleasant, but unfortunately what you keep getting at with this label and the diagnostic criteria, that all of this is much more complicated. But if you just put a label on someone, it keeps it neat, simple. It's just again, he's the bad one, I'm the virtuous one, and there's nothing to look at here. And unfortunately, then it would prevent one from getting into a more sort of regulated, self-reflective state of mind, I would imagine.
That's right. And when we engage in splitting, right, in essence, what we say is, well, that's all there is to know. That's all there is to know about this other person. And there's no need to, examine what might really be happening, to understand perhaps why this person is responding the way that they're responding. And that is one of the dangers of labeling, which is not to say that all labels are bad, but diagnosis is a necessary oversimplification. We use diagnoses to communicate in shorthand a much more complicated clinical picture, a much more complicated state of affairs about a person. It should not be used, diagnosis that is, as a way of saying, well, that's all there is to know about another person.
Yes.
Whether that's a patient or it's a romantic partner or a family member. I think that's an excellent point, Dr. Mazzella.
Let's go with this because you mentioned clinically. Maybe we could do this. If you have it at your fingertips, if you don't, it's okay. I could jump in with an example, but I'd love to ground this in a clinical example and get a sense, like if we could call it like a prototypical case that may walk in your door. So for the listeners, just so you know, Mark is also in private practice like myself. So I imagine that you're working with some of these individuals. How do you know, Mark, like when they come in, like in your mind, how do you know if somebody is struggling? Or I don't know if you think this far, like in terms of diagnosis, or if you think about narcissistic traits and characteristics, but how do you know and how do you differentiate that from, again, something you mentioned a little bit earlier, which is part of getting the clarity, is differentiating it from, like you mentioned, borderline personality disorder a couple moments ago.
Yes.
So how do you notice it? And then how do you distinguish it from something like borderline personality disorder, which obviously there's a lot of overlap between those two in one way because they both have the fragmented sense of self, right?
Yes.
Yeah.
It's an excellent question. And the analysts would respond by saying something about countertransference, about what happens in the countertransference and the patient's transference, right? So let's just paint a clinical picture of narcissistic pathology, of a severe narcissistic disorder. Patient comes in, let's assume it's a man. Let's say he's in his mid-30s. He's never been married. He's been in a string of short-term relationships. They all tend to end rather quickly. He has gone to college and has a college degree, but has been underemployed, at times unemployed completely, depends on his parents who are wealthy for financial assistance. When he comes in, he begins by asking me where I trained and went to school, what is my educational background and experience in the field, and may actually very quickly begin to devalue me in various ways. And, people like Dr. Kernberg might refer to this as the patient's envy of the therapist's ability to help and to understand them. So you have to remember that narcissistic structures are built on envy. That's a core feature of narcissistic.
Yes.
And when you look at this man's romantic relationships, they all tend to be rather brief and end in failure. Attempts on the part of the other person to get close to him are impeded. And, when I asked him what kind of plans he has for his future, he may reply that, I'm going to become a professional baseball player. I played baseball back in high school. I go to the batting cage every now and then. And, when I decide that it's time for me to really take up baseball, I'm going to make it to the minor leagues and I'll probably be in the majors one day. Well, we all know that somebody who's 35 years old doesn't just try out for the New York Yankees, right? So we've uncovered his grandiose fantasy. Right?
Okay.
And this is a central idea in narcissistic pathology, right? Is that the patient's very fragile sense of self, very fragile self-esteem is supported unconsciously by this pathological grandiose self, to use Kernberg's term, or, grandiose fantasy about the future.
Okay. So I want to point out something I appreciate immediately. Once you introduced the case, one of the things that you said was we recognize it in the countertransference. So I'm thinking about the listeners of this podcast. So in other words, what Mark is getting at is feelings inside of you, right? So it's not just that this guy is overly confident, he tends to exaggerate, or he has, I do air quotes, a big ego.
Yes.
Because you made it clear earlier that there's a healthy narcissism as well. And part of healthy narcissism could be feeling proud of your accomplishments, right? As long as you have accomplishments, like this fellow in this prototypical example, who's not a minor league baseball player even at this point, right?
Yes,
I'm not even sure if he played high school baseball, but the point being, right, that there's a healthy level, but you're saying that one thing that may help you distinguish or begin to think about narcissistic traits is a feeling that you get when you're with him. And it's interesting, I pick up on that because I imagined when I asked you that question, Mark, like, how would I respond? Like I'm always thinking about, like, if I'm going to ask a tough question, I want to think about, how I would respond as well. And one of the things I found myself saying, which was hard to articulate, was it's more of a feeling that you get when you're sitting with somebody like this, right? It's not just they have this big ego or they self-referential, like all of these traits that are like sort of the manifest presentation, which are there, of course, I get that. But you're getting at something more structural, something a little bit deeper. Yeah. And a term that we've used it on this podcast, that we call either projection or projective identification, which is there's a feeling now that's being put inside of you that you have to figure out, right, Mark?
That's right.
How much of this is coming from me? Did I feel this way? Do I typically feel this way with other people, with my other patients? Or is something being put into me because they cannot bear to tolerate that?
Yeah. And you just said it, right? I mean, and one of the things that I begin thinking about as I'm sitting with someone and thinking about the case or the patient is, do I normally feel this way in my personal life when I engage with other people? And if there's something that's off, if there's something that's different about the way that I'm feeling about or towards or with this other person, that may be an indication that there's some projective identification going on. In essence, the patient is inducing in me the feelings that are intolerable.
Yes, which in this example could be something like he starts questioning you about your practice or your experience, your level of education. So the feeling could be what? A feeling of inadequacy maybe, or that you're not sufficient or you're not enough.
All three, perhaps, right? And questioning even whether I can help this person, right?
Competent, whether you're competent enough then.
Whether I have any real skill, any real capacity.
Yeah.
Right.
Or capable. Let's say capable, since your example, it fits nicely with that. Whether you're capable of doing your job, because one thing that you mentioned was he wants to be a major or minor league baseball player, and he may disavow or he doesn't question, am I capable of doing that? He knows he's capable, right? But then you see, you're left wondering, am I capable? So you're holding that for him in a way.
Absolutely right. The key here for the listeners is that all of this exists within him. It has led me to feel and to experience a lot of these emotions, what Klein and Kernberg called projective identification. It sounds like you talk quite a bit about that concept on your podcast. But
we try to make things more complicated here on this show.
Well, the other things that you mentioned, though, is normal narcissism and healthy narcissism. I mean, I think that deserves some attention, right? This goes back even to Freud. Kohut talked about normal narcissism, right? And so, if we think about this dimensionally, and like I said, narcissistic personality is one of the personality disorders that is very amenable to dimensional approaches. I'm more skeptical about dimensional approaches when it comes to borderline and antisocial, and I'm writing a bit about that now. But narcissism is easy to conceptualize, and it makes a lot of sense to think about it dimensionally, right? We all need to love ourselves. We all need to have some sense of our own goodness, have to be proud of ourselves for realistic reasons, for our realistic accomplishments and achievements in the world, right? And this helps us. Healthy narcissism protects us from getting depressed. It helps protects us from feeling too anxious. It's very adaptive. In fact, if you look at probably some of the most successful people in the world, they have elevated levels of healthy narcissism, but they have not crossed the boundary into narcissistic traits or narcissistic personality disorder, right? I often like to use this example. I'm not sure if you're familiar with the better than average effect in psychology, but psychologists have studied this concept of the better than average effect. If you poll the general public, most people think that they are better than others in a variety of domains, right? Well, we all can't be better than average. Not all of those people, of course, are pathologically narcissistic, okay? There's something about feeling good about oneself in the world in a realistic way that's helpful and adaptive. It gets us through struggles. It allows us to navigate life's dilemmas more effectively. When narcissism begins to become pathological, that investment in ourselves is so significant that it basically takes away our capacity to invest meaningfully in others. And so I think of this as one of the core manifestations of pathological degrees of narcissism is when the self-love becomes so profound and so significant to such a great degree that it limits our ability to connect in a really meaningful and deep way with other people. And so as you start to get into that territory, that's when narcissism becomes pathological. But, this idea that the narcissistic person has a really robust self-esteem and thinks highly of himself and has a big ego, so to speak, it really doesn't actually capture narcissistic pathology very well. People who have good self-esteem, who may feel proud about their accomplishments and their achievements, those people tend to be pretty healthy. It's when it's so exaggerated and makes up for a deficit in the self The narcissistic patient has very fragile self-esteem. He
So
does not have a robust or good or healthy self-esteem, but this all gets mixed up, I think, in the pop culture.
In the next part of our conversation, what I want to do is go deeper into the internal world. And you were just starting to touch on that because you were distinguishing between healthy versus pathological narcissism. And one thing that you wrote about quite a bit in that article was the role of the grandiose fantasy. And of course, you mentioned it already earlier as you and I were talking. Sometimes I phrase it this way, the grandiose sense of self, because I think of it more like a structure that holds that fragmented self together, which is very common amongst all the different personality disorders, borderline as well as narcissism. So that's somewhere that I like to go with you is, what did you mean? Like, what is the grandiose fantasy? What is the person doing? Like, in other words, why is it there? Why is it helpful? What happens when it's not available? So let's move there next. And as we shift from just identifying narcissism and we go beyond labels into deeper into like the structure of what holds the narcissist together. There's still so much more to say about this, but we have to stop here for now. If this spoke to you and you're curious to learn more about all issues related to narcissism, please support the show by subscribing so you don't miss what's coming next. And even more importantly, take a moment to leave a review. Reviews make the podcast easier for others to find, which helps the show grow. The more the show grows, the more I can invest in creating thoughtful content that supports you in understanding and navigating your experiences with narcissism. Okay, thanks for being here with me. I'm grateful we got to explore this one together. Until next time, take care of yourself. Bye for now. Disclaimer alert. The Narcissism Decoder podcast is provided for general information purposes only. The content presented in this podcast is not intended to diagnose, treat, or cure any psychological condition related to narcissism. The content on this podcast should not be considered a substitute for professional medical advice, diagnosis, or treatment. For specific advice pertaining to narcissism or any other psychological condition, you could reach me directly. I am an experienced mental health practitioner who is always taking on new patients. If you would just like a consultation, I can do that too.